Am I getting enough vitamin D? This is a question everyone should ask themselves, and throughout this video, I will explain why and how vitamin D should be assessed. So why is vitamin D important? Most of us know about vitamin D's role in bone health, but vitamin D also plays an important role in muscles and cardiac function, inflammation, and immunity. Low vitamin D status is linked to increased risk of inflammatory and chronic diseases. In the body, vitamin D is involved in the transcriptional regulation of greater than 1,000 genes. There are three sources of vitamin D: sun, very few foods, and supplements. Foods which contain vitamin D are salmon, fortified milk, cereals, and orange juice, egg yolks, and some mushrooms. It is extremely tough to get enough vitamin D from food alone. So who's at risk? Well, everyone. Special populations to consider are athletes, children, hospital patients, and nursing home residents. It's important to note that vitamin D status among athletes is highly variable, and so it's important to consider individual differences. The following are important factors to consider when assessing vitamin D among all individuals, including athletes. All of these may increase a person's need for supplementation, including time spent indoors, outdoors, what time of day, living at greater than 35 degrees north or south latitude or in clouded, polluted environments, wearing sunscreen, protective clothing, dark, pigmented, or very light skin, excess body fat, malabsorption disorder, history of certain medications, and even genetics. Next, I'll go through the nutritional assessment of vitamin D status, beginning with anthropometric, biochemical, clinical, dietary, and environmental assessment. Starting with anthropometric, height, weight, and weight history should be assessed, followed by body mass index and body fat. Since vitamin D is a fat-soluble vitamin, it is sequestered in body fat. As a result, both body mass index and body fat are negatively associated with vitamin D status. The following chart shows the relationship between body fat and serum 25-hydroxy-D concentrations for both male and female athletes. It's clear here that as fat mass increases, serum levels of vitamin D decrease. For the biochemical assessment, 25-hydroxy-D is the main storage form of vitamin D that is used to assess vitamin D status. Parathyroid hormone may also be used to assess vitamin D status. In individuals who are vitamin D deficient, PTH will be increased. The following table shows serum levels of 25-hydroxy-D that are associated with deficiency, optimal levels, and toxicity. Serum levels of at least 32 nanograms per milliliter should be maintained. Currently, the US RDA for vitamin D is 600 IUs, which is enough to maintain serum 25-hydroxy-D just above deficient levels. The clinical assessment should consider the patient's history of stress fractures, frequent illnesses, bone and joint injuries, and muscle pain. Furthermore, a physical assessment which evaluates muscle weakness, pain with applied pressure to the sternum or tibia, and skin typing should be completed. Skin typing is an important aspect of the physical assessment since those with very dark or light skin may not synthesize vitamin D as well from the sun. Medications that may alter vitamin D metabolism or inhibit fat absorption should also be considered, as they will increase a person's risk for deficiency. For the dietary assessment, you'll want to evaluate the frequency of vitamin D-rich food consumption, keeping in mind the fat content of meals. For the environmental assessment, location is huge. Things to consider are altitude and climate, outdoor time in relation to peak sunlight, and for individuals living at latitudes greater than 35 degrees north or south, vitamin D will not be synthesized in the winter months, and thus supplementation is needed. Other environmental factors to consider include the use of sunscreen and protective clothing, both which will decrease a person's ability to synthesize vitamin D. If an individual is determined to have insufficient vitamin D, there are two treatment options. The first is safe sun exposure, and the second is supplementation. At least 1,500 to 2,000 IUs per day of vitamin D is needed to keep 25-hydroxy-D within sufficient ranges. In some cases, higher doses may be needed, thus patients should be assessed on an individual basis.